Let me ask you a question. If you raise the legal drinking age, do you reduce the rates of suicide in youth? The answer is yes. We talk a lot about the negative effects or consequences of using drugs or alcohol. But one of the things we don't talk about that much is the link between suicide and substance use. In the United States today, rates of suicide among young people are increasing dramatically. Teenagers who binge drink are up to 5 times more likely to attempt suicide. And teenagers who smoke marijuana daily are up to 7 times more likely to attempt suicide. We all have inhibitions. That's the brake that stops you from doing risky things. And when you're drunk or high, that brake doesn't get turned on. What can happen is that this makes us more likely to act on suicidal thoughts. Drinking or using drugs can also increase your feelings of being distressed, feeling sad, alone, or anxious, and you may be more likely to act on those feelings in the moment. It also limits your ability to problem solve and come up with strategies that can help you feel better. Substance use may also increase suicide over the long term by increasing distress and worsening mental health problems. People with mental health problems often use alcohol or drugs to feel better, to medicate the symptoms that they're experiencing. But unfortunately, what can happen is it can make the symptoms worse, leading someone to be more likely to act on suicidal thoughts. On the flip side, depression and anxiety can also occur when you stop using drugs. During this time, you may be more likely to feel suicidal as you recover and your brain learns to function normally again. People can use drugs and alcohol for all kinds of reasons. We use it to have fun, hang out with our friends, try something new. Some people, though, as we've talked about, use it to make themselves feel better, manage feelings of depression or anxiety, or maybe even to help them focus. But it can quickly get out of hand and it can be difficult to stop using the drug or alcohol. There can be lots of barriers why somebody doesn't seek treatment, but that's a missed opportunity because now there are several effective treatments for teenagers that really do work. Treatment is most effective when you get it immediately, and especially as a teenager. The earlier you get treatment, the better off you'll be as an adult. So what can you do if you see a friend or maybe you yourself are struggling with drugs or alcohol? Or maybe have suicidal thoughts? You can encourage a friend to seek treatment, but doing so can be tricky. A friend can get angry with you or push you away, but they may actually hear you. Feeling isolated and frustrated and alone is often a side effect of having an addiction. When you reach out to a friend, it may be just the help they need. You can also talk to a trusted adult in a confidential way, maybe an older brother or sister, or an aunt, or even a guidance counselor. Someone who will be able to help you find the resources that your friend needs. Watching your friend struggle with drug or alcohol use or suicidal thoughts can be difficult. Be a friend, but you don't have to be a therapist. Crisis hotlines for substance use and suicidal behavior are available, so you and your friends don't have to struggle alone. These include the Crisis Call Center, the Crisis Text Line, and Lifeline Crisis Chat.